Welcome to Fight Girls Fight. Welcome back to Fight Girls Fight. Welcome back to Fight Girls Fight. Welcome back, you guys. Welcome back. Welcome back, you guys, to Fight Girls Fight. So let's go ahead and get into it. You guys, we have talked about everything. We have been over everything from the moment that I was diagnosed to up until this point. Everything such as the diagnostic mammogram, the diagnostic ultrasound, the core needle biopsy, to my visit with my oncologist, my first appointment, my MRI, my appointment with my general surgeon. I taught you guys a little bit about different forms of breast cancer, and also we packed a chemo bag together, and I showed you what I had in my chemo bag that would help you be able to be successful in this journey. Things that you don't have to worry about. Just get everything prepared and planned. But it gives you tips and tricks and DIY ideas of different things. And hopefully in the comments, you guys have been talking to each other and getting to know each other more, to talk more and more about different things that you all could take to chemo, how you can prepare for chemo, what others may have done, and things like that. I have answered several questions from different people who watch the videos and just continue to educate, give resources, and encourage. I provided you guys with loads and loads of information, resources, different booklets, different websites to help you along the way during this journey. This video, we are going to talk about the first day of chemotherapy for me. And again, for those of you who are new, I say with all my videos, this is my experience. Your experience may be completely different than mine. However, the basis of everything is similar. Okay, so my facility where I received my treatments and care could be totally different than yours. Also, depending on the state as well, because I know some states do things a lot differently than we do here in Virginia. However, the information is still there for you just to help you along the way, whatever step you're in or whatever status or phase or part of the journey and process that you're on. It just gives you some more information and kind of give you a roundabout what to expect, even if it's not exactly what you expect. Okay, so we're going to talk about chemo and my first day of chemo. So when I woke up for my first day of chemo, I'd already been up twice, that earlier that morning and late the night before, taking my dexamethasone. You may not be prescribed that particular steroid, but you should be prescribed the steroid that you have to take, not the whole time you're on chemo, but just a few cycles, you have to take the dexamethasone. And in my previous video, I stated it's like putting your body to sleep, so it won't have such an inflammatory response to the chemotherapy. With the dexamethasone, I made sure I ate something with it. My go-to is peanut butter sandwiches or peanut butter and jelly sandwiches. I mean, it's 10 o'clock at night, 2-3 o'clock in the morning, you're taking the steroid. That's what happened with my experience. And so I had to make sure something was on my stomach that was hearty so I would not get sick. Okay, so in the morning, when it's time for me to wake up for get ready for my actual treatment, you guys, I was so nervous. I did not know what to expect, but the last thing I had to worry about is, was I prepared? Okay, because my angels made sure that I was prepared. All right, so previously I talk about my angels a lot during my videos. My angels I have one angel that lives here in Virginia with me. She also is a breast cancer survivor. She's that angel. And then I have my other angel in Philadelphia who I talk to a lot through this process. So I had everything that I needed to be successful, and that's the last thing I had to think about. Now I just focused on the journey. All right, everything is in place. My FMLA was in place. We talked about that in the previous video. My paperwork was back. It was approved like that, okay? Because they can't play with that. It's a federal thing. Remember that. So everything was ready for me, okay? So I got up, have breakfast. Now, keep in mind, they're going to tell you, and you're going to forget. You may forget. Not everyone has this reaction, but they warn everybody of it because I guess it's that many people that do. When you're fixing your breakfast, your chemo mornings, do not cook anything that has oil or grease. It will make you extremely sick. All right. It'll make you very sick. I forgot once or twice. Okay. Because you're just waking up doing what you typically would do. And I got really, really sick. My go-to was oatmeal. I love oatmeal. I love oatmeal. Now, some people don't like oatmeal, right? If you like grits, eat grits. If you want something that's hearty. So I made sure that I ate breakfast. The first thing I did was get that port ready. Okay, so like I said, I got my port ready, my numbing cream that my oncologist prescribed for me at the beginning. Had everything that I needed. Every prescription that he prescribed, I had it. All right, and I numbed up my port. I already had my plastic wrap cut out, and I put that on that port. On top of it, it protects your clothes and it keeps that numbing cream on the area so that it can numb your skin. Have I had my port accessed with? Yes. If I had it done without, yes. All right. Because you tend to just be like, I could do this. Right. But at first, I didn't know what it would feel like. For the first couple months, I did not know. So I was not messing with it. Right. But after that, I forgot one day and it was what it was. Okay. Because it has to sit on you for an hour. Now, the first day I was so nervous. I kept it on from the moment I woke up until the moment I sat in the chair. All right. So what my area was super numb. And she laughed when she pulled back like, you still, I want to make sure it's right. Okay. And for those of you who are new, have not seen that video, this is where my port was. All right. This scar right here was where it was originally inserted. And this scar is when it was removed. All right. So my port was here. All right. And I just was ready. Got dressed, got ready. Nervous. I prayed a lot. Took a couple pictures like, okay, I could do this, like just trying to motivate and encourage myself. When I got to the treatment facility, I went ahead and checked in. They put wristbands on your wrist. Wristbands, you guys. So they put your wristband on your wrist. It has your name, date of birth, and social. Your wrist, so they can make sure who you are and that you are the right person receiving the right medication. All right. They put your wristband on. Then you sit out in the waiting area. And then the first thing that happens is they do your labs. All right. So every time I went in, I went and sat down and got my labs drawn. Okay. They're testing to make sure that your blood levels are good. Your iron levels are good. And to make sure if you can have chemo. I'm just being honest with you. That was my experience. After that, I was weighed. Being weighed is very, very important because it tells the pharmacist within the facility or within the hospital that you're at receiving your treatments what amount and strength of chemo you can receive. Of course, you would go in, you would get your labs drawn, and then once your labs was drawn, they spun them down and they were done stats to read your iron levels and to make sure it was safe to give you chemo. That's really what it boils down to. Are you in a status where you're safe enough to receive the chemotherapy? That's what it was. Now, if your levels were not where they should be, right? They don't play with it, because if your levels are not right and they give you chemo, it could be real bad. All right. So they made sure they stuck to that. Have there been times that I walked into chemo and wasn't able to receive chemo? Yes, there were. And it was 2 times that I walked into chemo and I couldn't get it because my labs were that bad. They were that off. All right. And that makes you feel like, man, you know, I done missed a day or two. I think 2 or 3 times that happened to me. And I felt some kind of way because you're thinking, hey, I'm trying to fight. Okay. So I don't need, you know. So that taught me how to eat properly through my journey so that my labs could remain at pretty good standing, you know, not below the bad, but at least sit right here. I mean, come on. Your bags are not already ready for you. All right. They shouldn't be, because based on your weight, that has to tell them and guide them on, okay, is it, you know, how much can I give her and what strength can I give it to her? Okay, so that is the first things that happen. Once I knew that I got put in that chair, sometimes you sit out back out in the waiting area, and you're just like, Lord, I hope I can get it. Oh, I hope you saying a prayer. I hope I can get it today. Have I been doing everything I'm supposed to do? Am I eating the way that I should? Am I drinking my water the way that I should? 'Cause remember, we talked about hydration and how important that was. Am I doing everything on my side that I'm supposed to do in order to be able to receive treatment? All right. But when they pulled me back out of the waiting area and sat me into the chemo room in the chair, I knew I was good to go. All right. During that time, calls are being made. Yes, she's good. How does her labs look to you? They look good enough for her to have them. The doctor is approving them as you come in. As each patient comes in, the doctor's looking at them labs, baby. They looking and making sure it is safe enough for you to get chemotherapy. They have to do that. So please keep that in mind. Some people are like, well, just suppose, it's not, I shouldn't have it, or they're gonna know. Their eyes are constantly glued to the screens with each patient coming in. And sometimes you're sitting there, 5, 10 minutes, 20 minutes prior to. Now, let me keep this in mind for you guys, okay? Don't be afraid, right, when it comes down to that portion, because during that time, you really should be, you've already gotten the go to have it, because they put you back and sat you in the chair and let you know, like, you're good. We're just waiting for the dosage and stuff like that for the doctor to look at it. During that time, that's when Shamika walking in with her bag, okay? Let me do it for you again, okay? I got my bag. Hey, y'all. How y'all doing? Y'all are good? Everybody having a great day today? Hey, y'all, they're laughing. Here she come with that bag again. Here she come with that bag. Sure do. I have everything I need, Chad. Don't play with me, And that was my attitude the entire time. This is what we're doing, okay? This is what I did, okay? And then I sat in my little chair, which is a recliner, pulled myself back. I put on my neck pillow that I showed you guys in the previous video, pulled out my blanket, put it on. Pulled out my tablet or whatever I felt like I wanted to do at that time, and got ready to get my pre-medication. Pre-medication, as I mentioned to you before in the previous videos, is usually a cocktail of anti-nausea medications and things like that they give you prior to chemo to try to help you not be sick or, be nauseous during treatment. That is not fun, to be getting medication and you're sick to your stomach. That's not fun. So they give you pre-treatment. A part of the pre-treatment that I received was Benadryl. Okay, so they began the pre-treatment process, getting you ready for pre-treatment. Okay, so when she pulled that back and she saw you still got your numbing cream up there, sure do. She thought it was so funny. She wiped it gently and she wiped away the numbing cream. Now, I've shown you guys what it looks like. I'm going to show you again for those people who forgot and or was not on, have not seen that video. I'm going to show you what it looks like when you're going in to get. Now, this picture right here is from my port, it's my port pamphlet, but it shows you exactly what the tech is going to do. She's going to feel around and kind of just get an idea of where your port is. All right. Now, most ports have 3 little tiny dots. You can see it through my skin. My friends, you couldn't see it through theirs. And that, here goes they want to make sure that it's in place. It's not like everywhere, right? Because if so, that's a problem. But she could see the little 3 dots. Now, the 3 dots indicate like a bullseye. I hate to say it that way, but that's what it is, where that needle is going to go. Now, the needle itself does not look like a traditional straight stick needle. It actually has a little button on it. This is what some of them look like. Mine looked a little different, but it still had the same components on it, which was a needle that was straight, but it had a little curve at the base to it. And then it had these little clamps. So once they would say, all right, here we go, they would come, they would glove up, scoot up with you, have everything there. They have gauze there. They have wipes there. They have this alcohol kind of stick that you pop, and it looks like the thing that you scrub your dishes with, and they rub to sterilize it. And then they pull the thing. Everything's coming out of the packages. Everything is sterilized. Everything is nice and clean for you, because they are about to do something that is very invasive. They are going to say, all right, they'll fill it, kind of move it a little bit, make sure that it's in place real good and it's not moving and falling everywhere. And then they're going to say, okay, you ready? And they're going to have it on. They're going to be looking at you. They're going to be all in your face, baby. They're going to get used to that. Okay. There's no personal space during this journey. And they're going to say, okay, you ready? And you're going to say, mm-hmm. And they're going to say, all right, take a deep breath. They're already eyeing those 3 dots. Take a deep breath and you say, boop. And they're going to push it in. Okay, you don't feel the length of the needle, you just feel the initial stick. But with the numbing cream, you don't feel nothing. Okay, you may just feel them pressing, but that's it. All right, that's them holding it in place. Okay, and then it goes and it attaches to you. They put this, they put all this sticky stuff, and then to stick it on, to hold it on, and they put this thing to go around it to keep it in place. Some of the pictures that I have on my page shows me in treatment, and that thing stuck to me. You're going to see it. If you look, it's right there. All right. And then your pre-treatment starts and you are on your way. They talk to you prior to chemo starting. Before they give it to you, they're going to say, they're going to give you your pre-treatment, and they're not rushing. They're taking their time, letting this come into the system. You can ask as many questions as you want. You can be as transparent. Do not feel embarrassed, nervous to talk to them. They're people. They're going to be the people that's going to be taking care of you. However often you have to go in for treatment. So build a rapport with them if you really like. I wanted to have a positive experience, so that is what I did. I knew about their husbands, their kids, their family, what vacations they took. We laughed and talked. I knew about surprise engagements. I knew about Christmas trees and how much they cost. We talked about everything. So that's the type of rapport that I like to build with people that are taking care of me, because I want to get to know you, because we're going to be doing this and you're going to see things in me, and you're going to see responses from me that most people probably wouldn't see. But because we're in this situation, we're going to be in this situation together. When it's time for your chemo to be administered, what happened with at my facility, the techs would come up and they would get the chemo, the different bags, depending on what I was getting. Like I told you, I'm triple negative breast cancer. I was at the time. And so I had Keytruda, immunotherapy, every time. It went hand in hand with my chemotherapy. It helped my chemo do its job. They're getting different bags of chemo, for example. And they're like, okay, hey, so-and-so, can you come over here with me? Yeah, sure. This is what happened in my experience. The other nurse walked over, the other tech walked over. I have Shamika Washington here. And she started reading off my stats, okay? It wasn't like my social security number, nothing like that, but it was my name. It was the name of the medication she was giving me. It was the dosage that she was giving me. And then the other piece of information was one of them, I think it was the pack. So it's like blue tube, something as she going through, touching the tubes that the bag is hung up to. And then she's saying, this is going to be administered at this amount, in this amount of time, at this speed of drip. And then it's like, okay. And then the other nurse would sign off on it. And then she'll say, okay, you ready? Yes, we're going to get started. If you're having any symptoms, any concerns, if it's times you can't breathe, if you're feeling any way, pain, burning, heat, itching, anything, let me know. Do not wait. Let me know immediately. Yes, I will. So hello, if you guys have any symptoms, if you're feeling any kind of way, let them know, all right? Because that could mean that you could be allergic to, or that medication is not working well with your body. Do not feel as though you cannot tell them, hey, I'm feeling a little hot, or hey, I'm feeling a little okay? Because I felt a little hot before, okay? I got a little itchy before. So there are things that you have to be able to communicate. Again, I cannot stress this enough. You have to be your own advocate. You have to advocate for yourself. You have to speak up for yourself, okay? Don't feel embarrassed. Don't feel like you're bothering them or stopping the process, okay? This is your life, okay? This is your life. This is your experience, all right? And you're fighting this thing. So you need all the support, and add them onto your village, because I did. Okay. So I'm sitting there. The Benadryl by then, I'm sleepy. Okay. So I'm either asleep, and then you wake up because you're there for hours, right? So you go to sleep. I had music in my ears. Then I pulled out my tablet that I showed you guys in the last video, set it up, put on Tubi, put on Netflix, put on Peacock, and I watched movies. And in the midst of the movies, I felt comfortable. I would just doze off and go to sleep. All right. Now let me give you some ideas. Some people will come in there with full-on pajamas. Some people came in there fully dressed as if they were going out to dinner. Some people came in like me. I wore a lot of sweats. I wore sweatsuits. I wore sweatpants, shirts, t-shirts when I got cold, sweatshirts, comfortable sneakers. That's what I wore. I had my hair wrap on with my hair, after my kids shaved my hair off for me. So I was ready. Right? Let's talk about the snacks. I talked a little bit about the snacks before, but let's talk about it again. So I'm sitting there. I didn't went to sleep, had a little nap, woke up, still, chilling, relaxing. They got music playing. This is my experience. They had music playing. People were in there talking and laughing and joking, and nurses, and they come around with a basket that's bigger. I know the basket about this big, y'all. Okay? Full of every kind of cookie, crackers, chips, you could possibly imagine. Because in oncology, we need you to eat. Okay? This is not the time to watch your calories. This is not the time to watch what you drink. Now, I understand. We are all on this diet journey. All right? The diet. Remember this. The eating hints. Okay? By the National Cancer Institute, telling us what we should eat, what we should do this. And yes, you're still following this. But they had a basket at my facility that had everything in it, okay? A refrigerator that opened up, and I heard, come out of it. It was full of every drink, every juice, every soda. I'm telling you, I'm being very honest. Now, does that contradict what I just read in the last video about hydration? Absolutely. Does that contradict some of the things that are in the eating hints from the National Cancer Institute? Absolutely. But let me tell you something. Give yourself grace. Give yourself grace. If that's the one day is your treatment day that you can eat what they give you, treat yourself. Eat it. The basket is going to come around with treats and all these beautiful things. I was completely shocked because, again, it contradicts everything that I read, all the websites. But listen, have grace, all right? So, you get your snacks if you choose to, or you pull out what you brought. Remember, we talked about the little peanut butter, if you like a peanut butter, crackers, and things like that. You pull your little snacks out. You got your little water, whether it's a Stanley, a Yeti, a Walmart cup, a water bottle, but you got it, right? Because you want to make sure that you remain hydrated through this process at all times so that you do not get even more sick, dizzy, fatigued, and thrush and other things, okay? So after the snacks and during chemo, if you need to use the restroom, you raise, hey, I have to use the restroom. Are you weak? Can you walk? If you can't walk, they'll get a wheelchair, and your pole comes with you. All right, they'll unplug your pole, but the box that administers the treatment is charged. So even if they have to unplug it, it's still going, it's still on, and they will either walk you to the restroom and wait for you outside of the restroom and walk you back, or they'll wheel you to the restroom. And you just use the restroom. Make sure you wipe down before, use the restroom, wipe down after you flush, wash your hands real good, and let's get back to it. All right. Chemo really was easy for me. I'm so happy that my first was easy, but people come in there, y'all, they balled up on chairs. Some people don't want to talk. Some people have nothing to say. Some people you can try to talk to, they won't respond. Even the nurses, even the techs, they won't even talk to them. Or they'll just be in a bad mood and they don't want to be bothered. For whatever reason, they don't feel good, right? Some people ball up. You look, it's just a blanket, a ball, like a body in it with a blanket all balled up, and they're asleep. They don't want to talk. They just want to come get their treatment and be done. So for those people, they're handling it the best way they can. You could talk to those who are willing to talk, or a really, really nice lady sat beside me and she taught me how to play. I'm going to say it wrong now. Mahjong. She taught me how to play that. And we downloaded it on my phone together, honey. And she's like, this is what you do. Older lady. And now I'm addicted. I love Mahjong, if I said it correctly, but you know what I'm talking about. And I love it. And she taught me like a lot. Like we talked a lot. And the days that she wasn't there, that I was there, of course, I'm like, is she here? Is she good? They can't tell me but so much, but in my mind was just like, is she all right? Maybe she just missed today. You just never know. So after treatment, of course, my hubby bubby came back. I called him, hey, I'm about to be done. And he came back on and got me. By the time he got me, I was just coming out. When I was finished with that first treatment, I felt like I was on top of the world. Why? Because I thought it was going to be way worse than what it actually was. And I felt like I had conquered. Like, yes, I got through that. It was great. Okay, good. Okay, I could do this. Go home and lay down. Go home and rest. You may not feel immediate tiredness or fatigue, but trust me, it's coming. All right. So go home and rest. Get your sleep. Relax. Don't feel bad. To lay around, to get rest, to take care of yourself. Do it. You're going to need it. All right. So for those of you who are at this portion of your journey, of your fight, welcome. This is the beginning to different things. Some things are beautiful, some things are frustrating, some things are challenging. But either way, you can do it. You can do this. Keep pushing. The days you don't feel well, lay down. The days you do feel good, lay down. Rest. Okay? Rest your body. Your body is in a fight. Your body is fighting, okay? And the medication that we put in our bodies are fighting along with us. Any medications that your oncologist prescribes, which are usually like potassium, vitamins, and things like that nature, make sure you take those when you're supposed to. They're going to help your body. Your body needs all the help it can get. Stay hydrated as possible. Make sure you're eating. I know you don't have an appetite. You don't feel like eating, or every time you eat, you don't feel good. You get sick, whatever the case may be. Find something that you can eat. There's times the food tastes awful. It doesn't taste like you remember it tasting. Even if it's your favorite meal, it tastes terrible. And there's other times where, for me, it tasted like dirty dishwater. The grapes tasted like a bag of dirty dishwater. Keep the fight. Continue to fight. Continue to push. Continue to push and press. All right? If you know God, if you know Him and He knows you, pray. Remain in prayer through this. Don't give up. Pray. He'll carry you. He knows what you're going through. He sees it. He sees you. Don't feel like He did this to you. All right? Just give Him an opportunity to show you who He is. Add Him to your village, but have Him be the lead. Okay? And if that's not for you, then that's fine. Continue to remain encouraged and empowered through this. You can do it. And I know you're probably tired of, she said I can do it, but I can't. Yes, you can. If I could do it, you could do it. All right? So you guys got this. I'm so proud of you. You've made it so far. Do you know how far you've made it? Do you know how far you've come? You've navigated circumstances that you've never been in before. You've navigated situations, maybe with insurance companies or setting up appointments or transportation or just being able to just have what you need. You've set up, I mean, you've went through so much to this point, and you've made it right here to this place where you're set up to fight. You guys can do it. I'm so proud of you. Keep it going. If you have any questions or just need to talk, send me a message. You know, we could talk. I'm going to set up a Q&A. I'm going to go live one day and set up a Q&A. But the next video is going to be the rest of my fight. And I just want to share with you guys the different things that I experienced through it, and how I ended up right here. So come back and see me, you guys. Stay on this platform. If you know anyone that's newly diagnosed or going through the fight, or even in the journey as a survivor that's learning life as a survivor, share this. Fight, girls.